So let's just get started. I do want to say that this conversation is really a developing conversation. It's new for us. We have, as Lucia will share, we've been looking at the surveys. We've been doing surveys, we've been doing focus groups around discrimination and how it shows up for Californians applying for the assistance program, but what that means, why it's happening, who's experiencing it. We do know about some specific groups that we will share who have reported at it, reported experiencing discrimination at higher rates than others, but what I do want us to keep in mind is that there is a lot that's unknown, and we are just at the beginnings of actual, we can think about the policy implications on how to tackle the actual things that are really a lot of the deep-seated historical issues that we are struggling with everywhere, but show up, of course, within the CalFresh program as well. So that is why I wanted to have a conversation with Lucia and Kameron about this, because first, Lucia has been part of that's been 3 surveys that we do yearly, and so she's been able to see the trend over the years, and she's also been intimately a part of the focus groups that we did to sort of give qualitative understanding around what the quantitative numbers are telling us, a some framework about that. And for the last 3 years, Lucia has been a part of that, and so I wanted to have this conversation with her specifically. And then Kameron represents the Santa, I want to make sure, because I always say it's wrong, my mother is saying, it's the Santa Cruz Senior Services Network.
Senior Network Services.
Senior Network Services. And Kameron is filling in for Corinne Jones, who is also my mother, and would have been here speaking about older adults and the work that they're doing in Santa Cruz around older adults. And what we know from the work that we've done with Lucia and just in general is that our older adult population do experience a significant amount of challenges with accessing the benefits, CalFresh in particular, and that has been borne out in also around racial, ethnic lines, that there are older adults who are experiencing finding it harder to get access to benefits because not only is as a result of their age, but the intersectionality of race, language, location, all of those things. So Kameron has a lot of really great case managers on the ground experience, but then from a perspective of how we can start looking at how making improvements that will benefit the state. So with that, I am going to stop speaking other than to start asking these 2 amazing speakers some questions. And also first, I would give you an opportunity to sort of share who you are not through my filtering. So we'll start with you, Lucia. Can you just tell us a little bit about yourself and your organization and the work you've been doing with us?
Of course, I'm happy to. Is this work better? All right, I got it. So I'm Lucia del Puppo. I am a senior vice president with FMB Research. We are an opinion research firm based out of Oakland. We also have an office in Los Angeles. Our firm has been doing research among Californians for more than 40 years. I have not been there for 40 years. And we really, our expertise is public policy oriented issues, the things that are top of mind facing our state. And so I have had the privilege of working with Nourish California since 2020, since before they were Nourish California. And we do an annual statewide survey of 1,000 Californians with incomes at 200% or below the federal poverty level. So we've been able over time to track some trends and questions as well as adapt the survey as things have evolved, including stages of the pandemic and other relevant issues. Along with the survey, we have done annually a set of focus groups. These are small group discussions with Californians from different demographic groups, and the focus groups have changed year over year depending on some of the issues the organization is most interested in diving deep on. And so a lot of these have touched on these issues of discrimination and bias in the public benefit space. So I'm excited to talk through some of those findings with you all today.
Lucia. And next, we have our fabulous Kameron, who I got to meet today, but I've heard a million things I've been hearing about for a long time. So, Kameron, you.
Hi, my name is Medina, and born and raised in Santa Cruz, where I work as a lead case manager for Senior Network Services. They have been a foundation organization in Santa Cruz for, I think, over 50 years. Since the pandemic, our organization has changed and updated quite a bit, so we are in a big transition, and we are supporting more seniors than ever in our county. It's a big need, and they have so many needs, especially our Medi clients, which is Medicare, Medi-Cal, low income, fixed income. We strive to get the resources to them to allow them to live independently. That's Senior Network goal, is to allow our seniors to stay in their homes, apartments, whatever, living independently and not end up in various skilled nursing facilities. By doing that, we connect them with resources, and one of those resources is the CalFresh program. We found some positive things working with CalFresh and accessing simplified applications. We have a portal, and we work with Second Harvest Food Bank, which is a great resource. But then there are barriers that we encountered, and I assume we'll be discussing those barriers.
Yes, thank you. So I think that will be great for Lucia to sort of share what the findings have said about folks who are experiencing discrimination a little bit. So we have had, this year we did do a breakout that specifically was focusing on a focus group that looked at Black Californians specifically, because over the last few years we have identified, as Lucia will share the exact number, that there are those who identify as Black and African American Californians report discrimination at a significant rate. And that is interesting considering the food insecurity numbers that we come up with, demonstrating a lower amount of food insecurity population, even though that does not necessarily wear out throughout the state and nationally, but there is some numbers that sort of demonstrate that there are folks who have identified the discrimination is vary for them. So Lucia, can you tell us a little bit about the numbers that you have broken out for us today?
Yes, absolutely. And I think it's worth setting the stage of how this issue has kind of progressed over the last few years. We have asked a couple questions to assess food insecurity among Californians for the past 4 years. Pre-pandemic, roughly, I think 50% were telling us they were at least some of the time running out of food before they had money to buy more. And in 2023, 2/3 of respondents told us that. So that was among all Californians with incomes below 200% of federal poverty level. As part of that, we asked them what are the things that would be most helpful to them, and for by far the largest thing was kind of support paying for food, support paying for their necessities. And again, similarly, because of that, the barriers they experienced were around costs and inflation. What was notable was the discrepancy when it came to transportation issues, lack of culturally appropriate food, and stores in their neighborhoods. This was among all BIPOC respondents, higher than it was among white respondents. We have also asked this question year over year about experiences with discrimination when interacting with public programs. We first started asking about it kind of just interacting programs, and we started to break it out more narrowly in experiences of applying and renewing and continuing their applications. What we did see was that more than 1/3 of respondents, 35% of respondents across the board, had experienced unfair treatment or discrimination when interacting with CalFresh, WIC, school meals, or another public benefit program. Among African Americans, that was 51%, so far higher. Among Latinos, it was 37%. Among AAPI respondents, it was 40%, and among white respondents, it was 27%. So very high, and the common reason folks mentioned having this experience was because of their race or ethnicity or their ancestry and place of origin. And the way it kind of materialized, frankly, was poor treatment and poor service in that experience. And what's really important, though, aside from having that unfair and negative experience, is that it does impact the likelihood that folks will apply for benefits in the future, continue or finish their application. More than 3 in 5 indicated that it would impact their likelihood of continuing an application, and among Black Californians, that was even higher, with 7 in 10. And that kind of bore out a lot in the qualitative research we saw. Their folks did mention having negative experiences in programs, and if they didn't personally have it, they knew someone who had, but they also focused a lot on a piece that we didn't explore as much in the survey, which was the experience of actually using their benefit. When they go to the store, the experience of interacting with people in their community, and that was really prevalent and impactful as well in their choice to use their benefits or to pursue using benefits.
Thank you, Lucia. I'll share this.
Sorry, it's a little.
No, maybe I'll just thank you, Lucia, and I think that helps to transition to Karen, to speaking about the older adults. The point that you made around access, the treatment, right, around that actually affecting a person's ability to go, or a desire to go back. Because I feel like, Karen, in our conversations that I've had with those who serve older adults in particular, that these experiences, feeling maybe pushed, hurried, worried, not actually having had the time to speak to someone, does translate into the comfortability of wanting to even access this benefit. And what we see with older adults is there is this, reduced, not large use of the benefits they're eligible for. And some of those things we've heard as about those first experiences with the program. So could you share a little about not only your experience with the clients trying to get through these processes, but like when they talk to you about the experiences they had, how does that impact, their use of not only CalFresh, but other benefits they actually really do?
Yes, definitely. One of the biggest roadblocks that a lot of our seniors have is technology. Everything is just technology based. You're going to get an email, you're going to get a text, and it's their snail mail. They want things in writing, they want to speak to a person. It's even the cell phone, getting my clients to use the cell phone properly, be able to utilize it. They hang up, there's so many complications with technology, and the communication with all the benefits is technology based and email based. So we've definitely run into those challenges. Speaking over the phone, the length of phone calls, trying to, transportation, even getting to the store. You have to have certain services in place. They don't drive, they can't afford to take a taxi. The transportation services are overstretched as everything else is. Wait times are extremely long to get picked up, to be picked up once you're done with your chores, to try to go to the county building in order to do in person to address your benefits. There's 2 to 3 hour wait when you're there, and most of our seniors do not have the capacity, physically or mentally, to face these challenges. And as case managers, we are also, we have a lot of clients we want to serve, and to spend 3 hours with a client at a county building is definitely a struggle for us. We want to be there, but we can't. And so I think the age discrimination, technology, wait times, and access is definitely a struggle that causes our clients to restrict benefits, lose benefits. I have clients who are trying to get cards replaced. It's difficult. We have to be together to make those calls. You're on the phone waiting for several hours, and sometimes we just can't get it all done.
Yeah, Lucia, when we did the focus groups, and that's why Lucia is so great to have here, because we have done different types of focus groups throughout the year. And last year's focus group was specifically focused on those who identify as persons of color and are older adults as well. And some of the things that you highlighted, we heard in those focus groups. So if you could, I know that maybe that wasn't at the top of your memory, but I know that there are some of the things that we saw at that focus group that actually we saw this year with folks talking about housing. There's still specific issues in their experience seem to mirror a few of the concerns that we heard in the focus group with those older adults as well. And
I think something we've heard consistently across age groups, and including in that group of older adults, is that feeling of instability that comes with experiencing homelessness or housing insecurity. Particularly that one was very pronounced as a feeling of them creating uncertainty, challenges to accessing not only benefits, but then if you have a benefit, how you can use it, if you have space to store your food, place to cook, place to prepare it. The mental toll that those experiences take on your sense of worthiness and your ability to then execute on following up with waiting in line and following up on case managers' requests. And we saw it in younger people too. You know, there are people who said, I have a learning disability and this is really difficult to me, or I have anxiety, so just picking up the phone is really scary, and my family had to push me to pursue the benefits that I deserve. And I did see a noticeable difference among those who had a connection to a case manager that they trusted, and that was a huge source of support for folks. And I think that was one of the noticeable differences among the older adults and the younger folks, is that older adults in some ways at least the ones we spoke to, and I will admit that with the caveat that the ones that we spoke to were all already participating in CalFresh, so that obviously creates a different dynamic. But they all had multiple touch points into public benefits that created almost a little bit more of a security net than I noticed with the younger folks who were maybe only using CalFresh. And I think that also bears out in the survey, because we've consistently seen older adults reporting lower levels of food insecurity or lower levels of adverse experiences in the data. And we know that in reality, that may not be totally right, like maybe the survey is capturing, not fully capturing the lens of their experiences, just because it is a limited instrument. But yeah, I think that was a really big difference for me, and a big point was this connection to other supports and other programs, allowing them to then access benefits. And then one last thing that I think was also noticeable among the older adults versus the mixed age group was older adults said actually stigma has gone down. And I think that they were comparing it to Reagan era. They were citing, the horrible welfare queens term. Having lived through that, they felt like now things were a little bit better for them, whereas understandably the young people have a different baseline. And yeah, and also people who had experiences in other states. That makes a big difference, right? That lived experience of, and we've seen that throughout the research, and sorry, I don't mean to ramble, but it's all interconnected, is this idea that, that is unfortunate, and people say is that they're almost settling for this good enough, right? Like, I had this horrible experience over here, so this not so great experience here is good enough. And they know inside of them that that's not right. But that kind of has come across populations that we serve.
That is a really great segue to you about, as you were sharing about partnership, trusted partnerships, having the sort of, it sounded like I heard you say more holistic knowledge of multiple supports that older adults can have to support them. And that's one of the things I wanted to ask you about, Karen. As you said, with older adults, trusted partnership, who is giving them the information, how the information is coming to them. As you said, this technology is really, really important. And I guess, could you speak to some of what you have, what are maybe are trickling down for older adults who immigration might be a part of their challenges, and so they're less wanting to engage, and having trusted partners that know the programs, that know what they are eligible for is really important. So can you speak to what you found in best practices and what you're doing to get around these other challenges?
Yeah, definitely. Because we are working with older adults, they have lived many years, whether they were born in the U.S. or they moved here as young children, have gone through, and they are very comfortable in their relationship with county and benefits. So we don't really have a lot of, in my line of work, we do have Spanish speaking program, and that would be probably speaking a different format to this question, but it is not my personal experience. But the village that we create with our clients, and part of that is through the outreach that we do, and we go to senior living places, we go to senior fairs, gray bears, different places that we know the seniors are congregating for perhaps meals or maybe exercise or activities. We receive referrals through doctor's offices, Kaiser, Sutter. They all reach out to us when they have a client that they know could use additional resources. Skilled nursing facilities that are going to be releasing clients and know they don't have anyone at home to support them. So we start with that, and we start building this network of support, whether it would be the other visiting nurses, different care providers, IHSS, the food programs, Medi-Cal, Medicare, making sure that we have all these pieces. So you're slowly starting maybe with just a case manager, but we build this network that allows them to have more than just one person that is looking after them. And of course, also engaging family and friends when that opportunity presents themselves, and communication with everyone, and really working hard to build a good, trusting relationship with the client, and then showing results is really important. And sometimes the food programs that supply, in addition to CalFresh, there are a lot of Medi-Cal programs that we access food sources for our clients. That really helps when you can show some immediate results and you start building that trust right away. That's really important.
Right, so it's like being able to recognize that there's going to be a reason for giving all this information, or a reason for engaging you, because as we were talking about earlier, you having clients who getting assessed the benefit of only getting $23 a month, and that is, as you all know in this room, that's a lot of it. People go through a lot of process. You gotta go to the county, you gotta be driving people, having what we said, be driving around for $23 a month, and yes, that's great, and many people are extremely grateful for that, which we probably want to push back on being grateful for that, but having to feel that they need to do that, but being grateful for that, and that's, obviously not going to support the nutritional needs of anybody.
No, that's not, and it seems like, every year they just get cut, like the COLA goes up 3.2%, and I had a client whose benefit dropped 57%. So whatever those markers are and however they are made, it just dropped them into a whole nother, category of being able to go to the farmers markets where there's a partnership, where you buy 10, you get 10. In Santa Cruz, I'm not sure about over here, but we have partnerships like that, which help. But we do definitely have to access additional sources of healthy food for our clients. Through the Medi-Cal programs with Central Coast Alliance, we do have delivery of medically tailored meals, and they're working that out where we have several different agencies that we work with, depending on their palate, right? That first, I've had clients describe some of the food as hippie foods because they got quinoa in their deliveries. So then we kind of go through and see who's got mashed potatoes and gravy and things like that to find something that's going to satisfy everyone's palate. So there's different programs that deliver meals, grocery boxes that we're working with Medi-Cal to deliver. But again, all of that is accessing these resources and having your team able to help you do that, because a senior would not be able to access these on their own because of the technology barriers.
Karen, thank you for that context. And there's all kinds of things that have drawn out my mind from that. And Lucia, before we turn it over and sort of get some engagement from you all, what would you say that over the last years in the focus groups, could you leave us with some of the things that we should maybe look to start learning more about? Or do you have any, you always get very excited when we're in conversations about how we can, what we could use and how we can think about this, but what for you is top of mind of how we can go start thinking about this next year, or what kind of questions, direction we can take the questions to get you a different direction, I guess, than what we've been getting before, but also sort of keep in line with what the data has showed us and what these focus groups have been able to give us over the last couple of years?
Yeah, I think that's a great question. I definitely, the survey is 1,000 people statewide. It's drawn proportionally. So that means we ended up talking to about 100, just like 100, 150 Black Californians, more than 200, nearly 300 Latinos, which is a great sample size, and then less than 100 AAPI respondents. And so I would love to be able to go a little bit deeper on some of those groups. They have such distinct experiences that we hear in the focus groups, and a lot of what we see in the survey matches what we hear when people's voiced experiences are, but I think, if we had bigger samples, we could more fully capture some of the things we hear, particularly with the social stigma, the experience of, some of the things that we heard in the Black Californians group was about that experience of going to the store to buy something that they have a full right to buy because they should be able to buy whatever they want, if they want to go buy a steak or a crab or whatever, and the white person next to them said no. And they said, even if that person didn't say anything, they felt like stiffer in those situations. In the AAPI groups, we did groups among Chinese-speaking residents of Chinatown, and actually no, sorry, they were mostly in Chinatown, San Francisco, but we were drawing from a broader geography of the Bay Area, and they were talking about that experience in shopping in Chinatown, and that they felt looked down upon. So I think just being able to dive deeper in getting some of that quantitative data, I think to fully capture that, and think about ways to address in communications, the fact that people have a right to this. And that was actually one of the most heartening things to me about those older adults group, was even though they had faced so much adversity in their lives, some of them were like, I paid my taxes, I deserve this. And I just want everyone to kind of have that feeling that they deserve this.
Thank you, Lucia, and I do remember that being really empowering to hear, watching and observing the focus groups of folks talking about, maybe people are looking at me and whatever, but I deserve, and I know that I have the right to this food, which we all know it's absurd that anybody would feel that they aren't, but I really appreciate that. Karen, is there anything you want to sort of leave us with before we turn it over about what are the best practices for reaching our older adults, and what do you wish there was more resources towards either an advocacy or just direct resources to just make that better? And then we don't need to sort of hypothesize how it could be better, just you put more money in that and making that better.
Well, I think one of the things is we do know that we have a large aging population, right? More people are going to be turning 65 than we are going to be having kindergarten. So the situation is only going to become a larger problem for everyone. My clients, one of the stigmas, and I've had this conversation, is when they say food stamps, they remember the paper food stamps that were once used, and explaining to them that it's now a card. It's a simple, easy, little card you're going to swipe. So even getting through those barriers to some of the clients. But with the larger population that's going to be entering the older adult years, we have, like, the one resource is we have a simplified adult CalFresh Forum application that we can use. Very much simplified for the older adult. More programs that I think target the older population so that there's access, because they can't be on hold for 3 hours. So is there some way that there could be a task force that is more specified for the seniors? Because the application is a great place to start. It is simplified. It's only like 5 pages, and it's in big print, and it's very easy to get through. But once that first step is done, the rest of the steps are, again, very complicated and tech involved. So how do we approach that so that everyone has access?
Thank you so much, Karen. I love that you said it's a great process to be part of, like, making it simpler, and it would be great if I could just do the application, but one step at a time, I guess. We will be turning it over to you all for questions. Do you think we'll need a microphone for questions, or?
Yeah, we have a mic.
No. I got to see Michelle, but she wasn't there. Thank you, Michelle. Our lovely Michelle. Yes, questions, comments for us, our speakers. I know it's very intimate and very close, so.
I think there was one on toga. Let me pull it out. Someone asked a question.
How was our question?
I don't know, there was a question.
How we live stream?
Technology.
Maybe someone in person wanted to ask a question through the Q&A, but I can ask it and maybe you can answer. So I think we talked about this a little briefly, but what do studies reveal about barriers and challenges that exist for Asian Americans facing discrimination when applying for public health and social services?
Do you have any specific?
I do. So I think this is part of why I'm interested in diving deeper in the segment in the survey, because I think the survey, historically we've done it in English and Spanish, which I think creates some blind spots because we don't see the AAPI respondents reporting as many language barriers as other groups, and but we do hear that in the focus groups, and we hear primarily long wait times to speak with someone who speaks their language, and long time wait times in person for that kind of support, and poorly translated materials that feel like they've gone through Google Translate or the wrong regional dialect or whatever it is. So that was kind of the biggest one that has come out of our research.
Yeah, and one thing that is interesting that we found in the survey around Black African American Californians, having language barrier be one of the issues, and these are people who identify as speaking English. And for me, that means there's something about the language in which the government uses to speak to people that is off-putting. And then I don't think it ends up getting translated better. And so I think it continues to be off-putting in all the languages. And it's confusing because they talk about human-centered design teams that they have, but it's the how people are being spoken to is triggering people to feel something, and it's not just to like write their name, it's like beyond that. So I really appreciate that question and all of the different perspectives, because I was really shocked to see English speakers say that the language barrier was an issue. That was not what I would, there's a lot of other things that I would think English speakers have a barrier, but that was not it. So it is, we go back to the drawing boards, I think, on a larger scale, I think, if that's the issue. If we're not getting it right in the origin language which we're trying to speak, then I think that's probably an issue.
I have the mic.
It's funny, I did some consulting work with CDSS, and I used to joke that we should translate these documents into English, a language that I can understand.
Yeah.
And, a lot of the administrators will quietly admit that, the documents are incomprehensible. I've heard a county director admit that because he had adopted his son, so he got Medi-Cal letters from his own county. He said, I don't understand the letters that I get from my county, but I supervise. But what I did want to do was put in a little plug, because CDSS hired me a number of years ago to help redesign the SARS 2 Plus application, the SARS 7, and CF37. And one of our main goals is to make it easier to read and to navigate. The good news is we finished the work. The bad news is that CDSS has not implemented those documents, and they've been sitting anywhere from 2 to 4 years. So for all of you, if you want to see things that are easier to understand, you should tell CDSS that they should implement the things that they've been sitting on for multiple years.
That is a really good point, because that was focus groups and lots of people were part of that process. I think that's why ESAP, the simple application, is such a celebrated document, because frankly, that wasn't the first time that there was a simple document that had been created, but they don't get used. They sort of get created and sit in. That's why the ESAP was like, oh my gosh, we're actually getting one of these that was created with that intention. And so what you're sharing is really important, that a lot of work has gone into it because the influence is really important because of the community's need. And so they have to get them out and be using the documents that have the newer accessible language. So thank you for reminding about that, because I had forgotten.
Yeah, like I said, please encourage them to implement
Yes,
these documents.
implement the
So why they
documents.
don't Why they're just sitting on them and not using them?
They've never been able to explain it to me.
They probably have to be told, like, it's probably like the legislature probably doesn't require them.
No.
They probably, I mean, that's what they're choosing to do that, probably, maybe, I don't know.
That's not a legislative issue.
Yeah.
It's an operational issue in CDSS.
Great.
Hi, and just a memo for panelists, even if you don't have a mic, would you just be able to pass it around so that when we were able to catch the audio for the recording? Okay, yeah, just a reminder. And then I think,
Hi, thank you all for this. It was really informational. I'm curious, Lucia, when you did the surveys and the focus groups, did you also have questions, or did people talk about outreach and discrimination, biases and outreach, and how they found out if they were eligible for CalFresh, and if they felt like what services they used to find out if they were even eligible to begin with?
Yeah, that's a great question and an area we need to dive deeper in. I think one of the things, we did ask people how they found out about it, and honestly, it's almost completely word of mouth. This is from the focus groups primarily. As I noted, there were some interesting, again, folks who had already a connection to some other kind of, if there was a case manager with WIC, for example, that through the healthcare system. And then students were able to find resources through schools, which was great. Yeah, for the most part, it still is word of mouth.
I'm wondering if you have experienced anecdotally or in the data a difference in experience qualifying originally through the application versus re-qualifying through the RRR or the SAR-7. Are there aspects of discrimination or bias that are different between those two pathways that you have, again, anecdotally and through the data empirically seen?
In the survey, we asked them about the impact it would have on continuing or reapplying. We didn't ask them about the kind of rate different experience. I think one of the things, our focus primarily has been in the qualitative when we're talking about reapplying, was more about how being able to reapply online and the changes that were introduced to the pandemic, how those affected their experience, and their feedback there was positive. But that's a good question on whether those experiences of discrimination, we didn't parse those out.
And then as far as, I had recently submitted SAR-7 on several clients' behalf, and we did use I used the online system, and I was able to fairly simply get their renewal submitted through the portal, and it worked quite well. But again, it would be a technology issue that I, as a case manager, was able to easily do. But with my clients themselves, they have to receive the paper, they have to fill it out, and mail it back in. So the online portal worked quite well for the SAR-7.
I did want you to make a point here, and I forgot earlier, that, because you brought that back up, around your clients who might have cognitive decline. Sorry, I did want to make the point that you made earlier, apologies, about cognitive, your patients, your clients at various stages of cognition, like where they're at. Things like remembering to resubmit and remail things is a challenge. So let's just speak a little bit more to that.
So as we know with the Medi-Cal and CalFresh, we do tend to get large packets of information, and this very thick packet that arrives, only 10 of those pages need to be resubmitted, but it's overwhelming for the senior, especially as they climb, they see it, they put it aside, and they forget. We do try to submit ROIs with all of the applications that we do. We fill out as an authorized rep, everything. This doesn't always seem to translate and follow through. So we do not always receive duplicate notices that the clients get. So if they forget to call us, all of a sudden their benefits are going to be dropped. This does happen. What we do is we just get on there and try to work with them and reach out to whatever agency we're dealing with. But it doesn't happen. Benefits get frozen. I'm in the process right now. The card got lost. Instead of a number on the address, number 43, they turned it into apartment when they transposed the application. The EBT cards have been getting mailed out because they qualify for $90 a month. It's been only 2 months, but they froze everything. The card's been frozen. The client doesn't have access to food benefits right now, it's those phone calls again that we have to go through, and so it's a challenge. So it would be nice if we had an easier way, a portal that we could access, even partnership portals that would allow us to put input information on our clients' behalf. Did I answer that?
You absolutely did. There's probably speaking about that to some of that in partnerships, because that is one of the reasons why I wanted your organization to be here, because you all are a part of county, and you've also been part of the unwinding, what do they call it, the unwinding, when you're trying to get folks back onto Medi-Cal after they were dropped, and that you had a lot of challenges, being the people who are responsible for getting your clients back on, but not being able to know what the status is of applications or whatever. And so I wanted you all here to speak to sort of how being a RO, authorized person does not necessarily provide you with enough insight for your clients.
And following through with that contact, you're right, because even though we submit all these requests, when we're actually on the phone, like we've gotten through and we're speaking to a benefits provider, they're like, well, we don't have your ROI. And we can look in our records and see that, yes, we did submit it X amount of months ago when we originally applied. So making sure that somehow this information is with their applications, that we are the ones being contacted to support them. It's about a 50-50 where we do get notified and we don't. When we do, we reach right out to the client and make sure the packet's there. When we don't, sometimes they call us afterwards. So it's a challenge.
Any other questions? Okay.
So I have a comment and I have a question. So my comment is, a former eligibility worker could totally relate to having clients come in to translate their notices of action in the same language. What we heard as eligibility workers was that because it was government wording, it had to be stated like that and it had to be translated like that. So that was my comment on that. And my second was a question on your focus groups or your surveys, was there any research done as far as eligibility staff being biased, being discriminative to the community?
Yeah, and so actually, thank you for raising that, because it puts a final point on kind of everything I've been talking about, because there's kind of two contact places where we focus on this discrimination in the survey. A lot of the focus has been on that experience interacting with the program. We didn't specifically cite eligibility workers, but we assume that that's the main point of contact for folks. In the focus groups, we heard both versions of focus groups. The social experience in their community was elevated a bit more, but we did occasionally hear about those experiences with eligibility workers, ranging from, people having negative experiences with WIC, or which is less common. The experiences with WIC are generally a little bit more positive. But I was just thinking about this one woman who started crying in her groups, and she was a Black woman. It was actually a group on drinking water, and she was telling us, my mom's a veteran, she fought for our country, and I go here and I get treated horribly, and I don't deserve this, but I bite my tongue because I know that. So it did come up.
Hi, I have two questions if you all have the time. The first is, as somebody who works in an urban environment, did you see any major differences between like an urban community versus a more rural community in terms of access or discrimination or bias? And then, I'll ask my train of thought. This question, if I can come up. Yeah.
Less so on discrimination or bias. I could look in the data, but off the top of my head, that wasn't a big difference, but it's a good question. We did hear we heard different barriers, right? Some of the things we've heard when we've done groups among like people in the Central Valley who are in more car-dependent communities. That's a barrier if you don't have a car, if you need to rely on some kind of transit organized, so that looks distance. But on the flip side, we also heard, and I'm thinking of our group with Black Californians that we did last year, where folks were saying, I live in Oakland and there's no good grocery store near me, I'm driving really far, taking public transportation far. So it materialized maybe in slightly different ways, but yeah.
Do you have any sort of, do you have any context to that for, especially for older? What does Santa Cruz consider? Is that rural? Yeah.
We definitely have rural. I mean, we go from Scotts Valley all the way to Watsonville, Aptos. But for a senior who uses a walker or is in a wheelchair or, has mobility issues, 2 miles might as well be 20. They can't always, get on a public bus, the transportation. So transportation is definitely a barrier. We have a lot of transportation options for our clients for medical appointments, but not for the day-to-day tasks. Going to the grocery store, going to the bank, things of that nature. So that is definitely a barrier that they do, transportation. Whether you're, near or far, if you're in a walker and you're trying to walk uphill, it's a challenge.
Yeah, that last mile issue for older adults. So to your point, even if you're in a city that has, maybe there's a 5 miles or within 3 miles there, but it's like a walker, it's still going to be a barrier.
Yeah, our participants express that a lot, from my experience, our participants have expressed that a lot, that even if it's just a few blocks between their door and, say, a food pantry, it's still quite a bit of a walk, and with groceries, it's even more of a walk, because of the way, so the way back is actually harder than the way there.
I think what we find is that people start changing their diets too as a result of that. And that's wild that you have people who just have to make different choices about what they can eat now because of how they can get their food to their house. For older adults, that is really significant for their nutritional needs.
Yes, definitely the transportation, fresh food, right? We have a lot of farmers markets in Santa Cruz County, but how do our seniors get there and how do they get home? Right, the transportation issue again, because they're all throughout the county, but 2 blocks might as well be 20 miles.
Any other questions?
Microphone dance. So that if we're ending now, what will the options be for folks?
If we end now, the options will be to chill here, you can join this session here, or chill outside.
This lunch will be happening.
At 12:15.
Yes. So if there are any more questions, listen to what's medicine, and I really appreciate it. But before you all leave, I do want to thank Lucia and Kameron for not only being here, but for doing amazing work that you do in the world, and choosing to do amazing work is, an honorable thing, and I appreciate that you had the time to be here with us, and that you continue to help older adults, and you continue to help us do the work that we're doing. And thank you all for being a great audience, participants, and listening intensively. We hope we brought you something that you can take with, and see you for the rest of the day.